Today, I want to address a topic that is particularly relevant for people over the age of 65, the standard guidelines for blood pressure and heart rate. Over time, there has been a proliferation of misinformation regarding what constitutes normal blood pressure for the elderly. This misinformation often circulates widely, taking on many forms, but it typically begins with statements such as breaking news on blood pressure. The United States has officially stipulated that the standard blood pressure for those over 65 is 150/90. For even older individuals, readings of 160 or even 170 are considered normal. Furthermore, it is frequently suggested in these messages that as people age, their blood pressure naturally rises, leading to the misconception that older individuals do not need to be as vigilant in controlling their blood pressure, and that values between 150 and 160 mmHg are acceptable. However, Dr. Hong Weihong, a renowned cardiovascular expert at Starlight Hospital, strongly refutes these claims and underscores the critical importance of proper blood pressure management, particularly as people age. According to Dr. Weihong, effectively managing blood pressure is not merely about avoiding numbers on a chart, it is about preventing a cascade of potentially life-threatening conditions. These include stroke, heart disease, dementia, aortic dissection, kidney disease, and a host of other serious health risks. It is indeed true that blood pressure tends to rise as people get older. However, Dr. Weihong emphasizes that this natural increase does not mean that elevated blood pressure should be accepted or left uncontrolled. There is a vital distinction between blood pressure that rises naturally with age and blood pressure that becomes dangerously high. To illustrate this difference, consider the analogy of bone density. As people age, their bones naturally become more brittle. But this does not mean we should simply allow them to become increasingly fragile without intervention. Just as we take steps to prevent osteoporosis, we must also take proactive measures to manage blood pressure. Particularly in the context of Asian populations, there is a significant and well-documented link between high blood pressure and an increased risk of stroke. In fact, the blood pressure requirements and guidelines for Asians differ markedly from those of Western populations, primarily due to the higher incidence of stroke among Asians. Unlike in Western countries, where the primary cardiovascular concern is often heart disease, stroke represents the most significant threat related to high blood pressure in Asian populations. To understand the implications of this, consider the findings from 3 comprehensive studies that investigated the ratio of strokes to myocardial infarctions, heart attacks, in East Asians. The results were startling. The incidence of strokes in East Asians was found to be between 4 to 8.7 times higher than that of myocardial infarctions. In stark contrast, studies conducted in Caucasian populations in Europe and America revealed a different pattern, where the ratio of strokes to myocardial infarctions was much lower, ranging from 0.8 to 1.7. This discrepancy highlights the unique cardiovascular risks faced by Asian populations, underscoring the importance of tailored blood pressure management strategies. Adding to this body of evidence, the late scholar Shang Dong, who passed away in 2009, conducted a landmark study comparing the proportion of deaths from stroke versus myocardial infarction across 24 countries. His research, published in a leading cardiology journal, confirmed the same pattern. East Asians have a significantly higher proportion of strokes compared to myocardial infarctions than their Caucasian counterparts in Europe and America. This data reinforces the need for stringent blood pressure control, particularly in populations at higher risk for stroke. For the general adult population, the ideal blood pressure is widely regarded as being less than 140/90 mmHg. However, as individuals enter their senior years, particularly those over the age of 65, there is some flexibility in these guidelines. For this age group, a blood pressure reading of less than 150/90 mmHg is considered acceptable. It is essential to understand that while there is some leeway in these numbers, this does not imply that significantly higher blood pressure should be tolerated without concern or intervention. As for heart rate, the standard for adults, including those over 65, remains between 60 to 100 beats per minute. However, it's important to note that certain groups, particularly those involved in specific occupations or with particular physical conditions, may have a heart rate that falls outside this range without it being cause for concern. The key factor is how the individual feels. If the body is functioning well, there's generally no need to worry. However, for diabetic patients over 65, monitoring both blood pressure and heart rate becomes even more critical. An important indicator to watch for is the change, or lack thereof, in heart rate before and after exercise. If there is little to no change, this could signal a blockage in the carotid artery, the heart, or other major blood vessels, which could mean the presence of plaques. These plaques can significantly increase the risk of acute myocardial infarction, heart attack, or stroke. In such cases, prompt medical examination is crucial. When it comes to heart rate irregularities, whether the heart rate is too fast or too slow, it's essential to screen for underlying conditions under the guidance of a healthcare provider. Among the elderly, it is more common to experience a slow heart rate, which could be due to conditions such as sinus bradycardia or hyperkalemia. Timely electrocardiography, ECG, and other diagnostic tests are recommended when these issues are detected to ensure early treatment and management. High blood pressure remains one of the most significant risk factors for stroke. The correlation between stroke and blood pressure is direct and profound. The lower the blood pressure, the lower the likelihood of experiencing a stroke. However, it's important to strike a balance, as blood pressure should not be lowered to the point of causing other health issues. Given these considerations, the recommended blood pressure values for Taiwanese and other Asian populations naturally differ from those of Western populations. Recognizing these differences, Dr. Wang Zonga of National Taiwan University Hospital, in collaboration with researchers from mainland China, conducted a pivotal study published at the end of August 2021. This study was specifically aimed at clarifying optimal blood pressure control for Chinese individuals aged 60 to 80. Because this research was focused on Asian populations, its findings are considered to be of greater relevance to this demographic than studies conducted on Western populations. The study honed in on three critical aspects. First, the physiological and cardiovascular differences between Chinese and Western populations. Second, whether it is more beneficial to maintain slightly higher or slightly lower blood pressure between the ages of 60 and 80. And third, the importance of home blood pressure monitoring as opposed to relying solely on measurements taken in a clinical setting. When it comes to managing high blood pressure, the role of beverages such as green tea and coffee has been a topic of significant interest, especially among those seeking natural ways to control their blood pressure. The question of whether high blood pressure patients should consume green tea or coffee, and which of these beverages is more beneficial without posing harm, has been explored in various scientific studies. Among these, a particularly noteworthy study from Japan provides valuable insights. According to this Japanese study, individuals whose blood pressure falls into the categories of normal high blood pressure or mild hypertension can actually benefit from the daily consumption of green tea. The study reveals that drinking a specific number of cups of green tea each day not only poses no risk to these individuals, but also confers several health benefits. These benefits include the potential to lower blood pressure levels and reduce body fat, making green tea an advantageous choice for those looking to manage their hypertension naturally. However, the situation is quite different for coffee drinkers, particularly for those with more severe forms of hypertension. The research warns that patients with severe hypertension, those whose blood pressure readings are significantly above the normal range, should exercise caution when consuming coffee. The findings suggest that for these individuals, drinking coffee may lead to an abrupt increase in blood pressure, which can significantly elevate the risk of cardiovascular events, including heart disease and even sudden death. This stark contrast between the effects of green tea and coffee underscores the importance of choosing the right beverage for managing high blood pressure. Adding further credibility to these findings, nutritionist Zhang Xinggu highlighted a comprehensive study conducted by a Japanese research team, which was published in 2022 in the esteemed American Heart Association Journal. This prospective observational study involved a substantial sample of 18,793 participants, whose blood pressure readings were meticulously categorized into 6 distinct groups: ideal blood pressure, below 120/80 mmHg, normal blood pressure, below 130/85 mmHg, normal high blood pressure, 130/139/85/89 mmHg, stage 1, hypertension, 140/159/90/99 mmHg, stage 2, hypertension, 160/179/100/19 mmHg, stage 3, severe hypertension, 180/110 mmHg or higher. The results of this study were illuminating. For individuals with ideal blood pressure below 120/80 mm, or those with mild hypertension, stage 1, drinking coffee posed no significant risk. In these cases, moderate coffee consumption did not appear to exacerbate their condition or lead to adverse health outcomes. However, the study found that for those in the higher stages of hypertension, particularly stage 2 and stage 3, drinking more than 2 cups of coffee per day could be perilous. Specifically, it was observed that such coffee consumption could cause a sudden and potentially dangerous spike in blood pressure, which might even double the risk of death from cardiovascular disease. This finding is critical as it highlights the potential dangers of coffee for individuals with severe hypertension, emphasizing the need for careful dietary choices in managing their condition. On the other hand, the study presented a much more favorable outlook for green tea consumption. The research demonstrated that drinking green tea carried no risks, even for individuals with various blood pressure levels, including those with normal or slightly elevated readings. In fact, the study indicated that consuming 1 to 2 cups of green tea daily was beneficial across the board. For individuals with normal high blood pressure, 130/139/85/89 mmHg, or mild hypertension, stage 1, the benefits were even more pronounced. These individuals were shown to derive significant health advantages from consuming as many as 5 to 6 cups of green tea each day. Nutritionist Zhang Xinggu elaborated on the reasons behind these benefits, pointing out that green tea is rich in polyphenols, natural compounds that have been widely studied for their health-promoting properties. Among these polyphenols, catechins and epigallocatechin gallate, EGCG, stand out as particularly beneficial. These compounds are known for their potent anti-inflammatory and antioxidant effects, which contribute to a range of health benefits. In addition to lowering blood pressure, catechins and EGCG can help reduce body fat, lower cholesterol levels, and support overall cardiovascular health. The study also found that individuals who drank more green tea tended to have lower total cholesterol levels, further supporting the cardiovascular benefits of this beverage. In contrast, while coffee does contain some beneficial compounds, such as chlorogenic acid, magnesium, and certain diterpenes like cafestol and caweol, its impact on cardiovascular health is more complex. These compounds can, in fact, lower blood cholesterol levels, reduce inflammation, and improve the function of endothelial cells, which line the blood vessels. For the general population, these effects might counterbalance the negative aspects of coffee consumption, such as the stimulating effects of caffeine on blood pressure. However, for those with severe hypertension, the overall impact of coffee can be detrimental. The stimulating effect of caffeine may override the beneficial effects of other compounds, leading to increased blood pressure and heightened cardiovascular risk. Given this nuanced understanding, the recommendation for those with high blood pressure is clear: to lower blood pressure and reduce cardiovascular risk, substituting green tea for coffee is advisable. Green tea offers a safer alternative, particularly for individuals with higher stages of hypertension. In addition to making this dietary change, it is also recommended that individuals engage in regular physical activity, maintain a balanced diet, and work on achieving a healthy weight, all of which contribute to better blood pressure management and overall health. In conclusion, while both green tea and coffee have their place in a healthy diet, those with high blood pressure, especially severe hypertension, should carefully consider their beverage choices. Green tea emerges as a safe and beneficial option for managing blood pressure, whereas coffee, particularly in larger quantities, should be approached with caution. This careful selection of beverages, along with other healthy lifestyle practices, can make a significant difference in managing hypertension and reducing the risk of cardiovascular complications. To effectively lower blood pressure, a multifaceted approach is recommended. This includes substituting green tea for coffee, particularly for those at risk of hypertension, as green tea has been shown to have blood pressure-lowering properties without the potential negative effects associated with coffee. Additionally, engaging in weight loss, regular exercise, and maintaining a balanced diet are crucial components of a healthy lifestyle that can significantly impact blood pressure levels. Beyond these general recommendations, there are specific lifestyle changes and considerations that can further help in managing and lowering blood pressure. Here's a detailed exploration of these strategies. 1. Maintain a peaceful lifestyle. The connection between mental and physical health is profound, and the impact of stress, anger, and irritation on blood pressure is well documented. Many diseases, including hypertension, are closely linked to one's emotional state. Maintaining a peaceful and calm mindset is essential for overall health, and this is particularly true for managing blood pressure. Chronic stress and negative emotions, such as anger and irritability, can lead to spikes in blood pressure, contributing to the long-term risk of cardiovascular diseases. To foster a peaceful lifestyle, it's important to actively engage in stress reduction practices. Techniques such as deep breathing exercises, meditation, mindfulness, and yoga can be incredibly effective in reducing stress levels. Additionally, engaging in hobbies that bring joy and relaxation, such as reading, gardening, or spending time in nature, can help maintain emotional balance. Social connections also play a crucial role. Spending time with loved ones, talking to friends, and participating in community activities can provide emotional support and enhance mental well-being. It's not just about avoiding stress, but actively seeking out and nurturing sources of peace and happiness in daily life. 2. Quit smoking and drinking. For individuals over 65, the impact of smoking and drinking on blood pressure and overall health cannot be overstated. Both habits are known to cause significant harm to various bodily functions and are particularly damaging to the cardiovascular system. Smoking, for instance, damages the lining of the arteries, leading to atherosclerosis, a condition characterized by the hardening and narrowing of the arteries, which increases blood pressure and the risk of heart attacks and strokes. Additionally, the nicotine in cigarettes can raise blood pressure by stimulating the nervous system, leading to vasoconstriction or the tightening of blood vessels. Alcohol, particularly in excessive amounts, can also contribute to high blood pressure. Alcohol can interfere with the effectiveness of hypertension medications, increase blood pressure directly, and contribute to weight gain, which further exacerbates high blood pressure. For those who are accustomed to regular alcohol consumption, it's advisable to gradually reduce intake and seek support if necessary. Professional guidance, support groups, and lifestyle counseling can be invaluable in helping individuals quit smoking and reduce alcohol consumption, leading to better blood pressure control and overall health. 3. Maintain a healthy diet. The adage, "Illness comes from the mouth," is especially true when it comes to managing blood pressure. Diet plays a pivotal role in maintaining health, and for middle-aged and elderly people, it becomes increasingly important as their bodies undergo changes that affect metabolism, digestion, and overall function. As people age, their physical functions may decline, making it crucial to manage their diet carefully. A balanced diet rich in nutrients not only supports overall health, but also helps stabilize blood pressure and heart rate. To effectively manage blood pressure, it is recommended to adopt a diet that is low in sodium and rich in potassium, magnesium, and calcium, minerals known to help control blood pressure. This can be achieved by consuming a variety of fresh fruits and vegetables, whole grains, lean proteins, and low-fat dairy products. The dietary approaches to stop hypertension, DASH diet, is often recommended for individuals with high blood pressure, as it emphasizes these foods and limits the intake of salt, red meat, and sweets. In addition to focusing on nutrient-dense foods, it is important to reduce the intake of processed and high-fat foods, which can contribute to weight gain and increase the risk of hypertension. A diet that is light, easily digestible, and rich in proteins and vitamins helps reduce the burden on the body, particularly the cardiovascular system, and provides the necessary nutrients to maintain health. Portion control and mindful eating are also essential practices that can prevent overeating and help manage weight, further contributing to lower blood pressure.